What's the further route from under the NHS? Charlotte said that she had her tonsils and adenoids removed about 4 years ago, and it cured her obstructive sleep apnea. She does say that the recovery from the op was horrendous, though.
Yes,
are there other remedies in the NHS?
There can be surgery. Surgery can be implicated in certain people to basically cut away some of the fleshy bit of the soft palate. There are a number of ways of doing this. One is a surgeon with a scalpel slashing away relatively randomly. The other one is using lasers or using heat. So you just heat the soft palate and shorten it or reduce it in size that way. It's known as a UPPP, and please don't ask me to pronounce what that stands for. But it is essentially what an ENT surgeon could do. The issue is it is a pretty imprecise operation, and it makes things better in a good number of people. It has no effect in probably a large number of people, and can even make the situation worse in maybe 20% of the people. So just being offered an operation is not necessarily the end of all your problems. And knowing the reputation of your surgeon and his success rate of your surgeon is very, very key to this. And again, this is not something that is done in the UK. We don't get league tables of surgeons. I have a personal friend he practices both in Denmark and in Norway as an ENT surgeon, and if I ever had a problem, I would definitely go and see this man, because I know I know his reputation. I've seen the success of his work, but that's a privileged position for me to know that. You're jobbing. is Professor Søren Berg, who works predominantly at the Lovisenberg Hospital in Oslo. And his colleagues. There's a number of colleagues there. I mean, it's one of the leading it's the leading centre in Scandinavia. So yes, these things, but as I say, within the NHS, it can just be a hit and miss affair. But there are other things that can help. I mean, talking earlier about having a large neck. Losing weight can help. Some people only experience this if they're sleeping on their back, because, of course, everything drops back. So sewing a tennis ball in the back of your pajamas so you can't lie on your back. So some of these things may reduce sleep apnea. It won't make the sleep apnea go away, but then it may drop it from being a bit of a problem to so what. It's not going to do anything for severe sleep apnea, but they say there are lifestyle changes. Some people may only do it when they've drunk alcohol. So I say at both ends, there's the extreme end of surgery, but there is some lifestyle changes. But I say the first thing is to acknowledge that you have sleep apnea and that it is an issue that you wish to have to resolve, to have fixed. If you don't do that, then nothing's going to help.